Hi, a very good evening to all of you, and also a warm welcome to all our viewers who have joined us on the show. Welcome to our YouTube channel, Skepta. I'm your host, Dr. Mani Iyer. Before we start, I request every one of you to please subscribe to this channel, like this video, and also share this video with all your friends and relatives. This will go in a long way in helping us and in supporting us to produce many more such videos and bring them to you. Okay, all right, let's begin. Uh, Mental health has become one of the most talked about topics in recent years, yet therapy remains one of the most misunderstood. Many people still wonder, is therapy only for people with serious mental illness? Will a therapist judge me? What actually happens inside a therapy room? Or perhaps the biggest question is, how do I know if therapy is even right for me? So today we are going to answer all these questions for you. Joining me today is Ms. Simrin Bhargava, trauma-informed psychologist and RCS scholar. She works with the individuals experiencing anxiety, depression, trauma, dissociation, emotional difficulties, and life transitions, self-discovery through an eclectic, integrative, and evidence-based approach. She also has been interested in astrology, numerology, and spirituality. Today's session is titled Inside the Therapy Room: What No One Tells You. This this session is designed not just for people considering therapy, but for anyone who wants to understand what therapy actually is and what it is not. So please join me in welcoming Ms. Simranji. Ms. Simranji, please welcome to the show, and yeah, the floor is yours.
Thank you so much for that lovely introduction, Dr. Mani. Hello, everyone. I'm genuinely very happy that each one of you decided to spend this hour with me because whether you clicked on this session out of curiosity, because someone suggested therapy, because someone has been struggling, or simply because mental health is one topic that really interests you, you're in the right place. I'd like to begin with a question. The answer, there are no right or wrong answers. Just be honest. Just an honest thought. Whenever you hear about the word therapy, what is the very first image that comes in your mind? Take a moment. Maybe it's someone lying on the couch, someone crying, someone saying, "So tell me about your childhood." Write these affirmations, or perhaps someone thinks therapy is only for people who are mad. So today, I want to take the mystery out of therapy, what it feels like, how it works, and how to choose and work with a therapist so the process is effective and more human. In the session, my aim is very practical. By the end of the session, you'll know what to expect, what to ask, and how to recognize where therapy is and how it is helping.
Have you ever felt like you needed support, but didn't know whether what you were going through were serious enough for therapy? So let's begin by understanding why therapy matters.
Yeah. So, speaking, we live in a time where mental health conversations are more common, yet there is some misunderstanding and stigma that still persists. People often hesitate because they don't know what therapy really involves, or they worry about being judged or thinking what others will think about them, or am I mad? Am I crazy? So let us start with the most basic question: why therapy matters. So therapy matters because human beings go through pain that is not always very visible. Some pain shows up as anxiety, some appears as sleeplessness, some shows up as anger, withdrawal, overthinking, low confidence, relationship difficulties, or the feeling that life is just moving, you're just there, or everything is numb. But that is not what actually is happening. Therapy is something that gives you a space where your inner world can be spoken, understood, and worked through with structure, safety, and support. Therapy is not only for severe mental illnesses. This is one conception that a lot of people have. So people come to therapy for different reasons. It can be grief, breakup, family conflict, stress at work, low self-worth, trauma, decision making issues, parenting struggle, abuse, academic pressure, addiction, and there are no end to the problems that people might be facing. Along with that, it is also a way that can be used for growth, clarity, and emotional development. That broader role is widely recognized in the mental health education and practice. So, if you ever you ever told yourself, my problem is not serious for therapy, I want to gently challenge that thought. And sometimes the reason people wait too long is because they think they might fall apart completely before they deserve support. That is not true. You don't need to be at your worst to begin healing. Therapy can actually help you in three major ways. First, it helps you understand yourself better. Second, it helps you change patterns that are hurting in your life. Third, it helps you change. Third, it helps you build tools that uh, are easy to manage. And one more thing, therapy is no magic, but it is powerful. It empowers you. It is not about a therapist fixing you. It is about you creating a process where insight, skills, and emotional work can happen all together.
Thanks, Simranji. So that certain uncertainty is actually very common. Many people wait because they think their pain must look extreme before it deserves attention. Many people carry that belief, and because of it, they delay support for months or even years. Let's unpack what therapy really is. Can we start with what is the biggest misconception or myth you have heard about therapy? So let's talk about the most common misconceptions.
Yeah. So now let's quickly dispel a few persistent myths and talk about them. The very first myth is therapy is only for people who are ill or mad. And this is not the truth. The truth is that it is for any human facing difficulty or wanting growth. People seek therapy for everyday issues. So, therapy is for anyone who wants support, who wants to change their pattern, be better at managing, discover themselves. Second, therapists aren't advice givers. A lot of people have this conception that in therapy, a lot of advice giving is there. That is not there. Therapy is more of a very collaborative process. It's about helping you discover your patterns, needs, trigger, from where things are coming, how to rewire your mindset that is limiting you to move ahead in life, and eventually how to be the best version of you. Thirdly, it is seeking therapy is a sign of weakness. A lot of people think that if I go to a therapist, I am weak. But no, in reality, it is such a courageous move. It it actually shows how much strength you have and how much willing you are to change your life. Fourth, therapy fixes everything quickly. No, it doesn't. But in reality, it is a slow process. Process can actually vary, and Some things change fast, some things take time, because a lot of from so long your problems have been there, so it does take time for you to heal. So sometimes therapy is short term and focus, sometimes it is long term. Duration depends on the nature of the concern and the goals, the pace of the change, and the approach used. So let me say this clearly: therapy should not feel very vague, confusing, or directionless. It should feel like a process with meaning, structure, and progress. So, therapy is a collaborative process that empowers you and can help you build self sufficiency. So, let me ask you all something. Have you ever wanted help, but the thought that I don't even know what to say in therapy? And this is one of the very common questions a lot of people have. And the answer is, you do not need to be perfect, or you do not need to be come prepared with anything. I completely understand that a lot of people face this anxiousness when they are about to have their first session. So you can begin with something as simple as just telling your psychologist, your therapist, that I feel very overwhelmed. I keep repeating the same pattern. I do not understand, why do I react like this? I'm not able to sleep well. I'm feeling very anxious, and etc. There's no limit to the complaints that people might have, but that is enough to really begin with. So I'll say therapy is not an exam. You do not need the right answers. You need honesty, even if it comes in fragments.
Okay, thank you so much, ma'am. So let us maybe go into the next segment of our, podcast, which is psychologists versus psychiatrists and other professionals. What are the differences? So I see usually the myths people hear are that some ones that keep them away from help. Moving forward, let's talk about how we can choose which mental health professional to consult, as a lot of people get confused between psychologists and psychotherapists and psychiatrists.
Yeah, yes. People often get confused between psychologist and psychiatrist. So, a psychiatrist is a doctor who can prescribe medicines and often handle diagnosis and the pharmacological treatment. Whereas a psychologist uh, is a professional. Usually, they have done doctoral or master's level degree in psychology, and they specialize basically in assessment and psychotherapy. So, in practice, many people benefit from both medication and therapy depending on the concern they have, depending on the severity of their concern. So, in a way, they both consulting a psychologist and a psychiatrist in a way is complementary rather than competing. The client, or say the patient, is supposed to decide as per their level of concern. Also, remember there are many other mental health professionals like counselors, family therapists, and other rehabilitation psychologists. So, there are different credentialed professionals, and they all come up with different training and role to practice. So within psychology, clinicians can specialize like for conditions such as depression, anxiety, OCD, trauma, or severe level mental illnesses. Clinical psychologists focus on these cases. They basically do all the assessment and psychotherapy part for milder or moderate level concerns like stress, relationship concerns, life transition issues, or self esteem issues. You can consult a counseling psychologist for child related concerns. related to their developmental concerns, you can always look out for a child psychologist. While for memory and brain related difficulties, consulting a neuropsychologist will be a good option. And there are counselors like for couple and family therapy if someone wants to take. So basically, choosing the right mental health professional for your as per your concern is one of the important steps in getting the effective support. However, many people are still unaware of the differences between various mental health professionals and which one is suited best for their needs. So I hope this session helps them. And because there is also a lack of awareness, which often leads to confusion, delays, and actually it can lead to delay in seeking the right help at the right time. So I hope this session increases public awareness about the roles of mental health professionals. That is very important for people to know and
Yeah,
make the right informed decision.
yeah. Thank you so much, Simranji, for this very detailed, analysis and telling us whom to consult and what for what purposes, etc. Because many people they get confused here, and that confusion all itself leads to a lot of delays and to getting the right kind of help. So, moving ahead in this session, could you shed some light on how do you know whether a therapist is actually the right one for you?
Yeah. So, speaking on this, I will share a brief checklist which you can get for better clarity. So, verifying the credential and license. In India, look for relevant degrees. If someone is presenting, for example, if someone is presenting themselves as a clinical psychologist, they should see if they are RCA recognized, they have a CRO number with them. While for other professionals, look for their qualification and um, education for better clarity. Then people can check for the specialization and experience uh, about the professional. Ask whether the therapist has worked with people um, who have related to their concern. Understanding the approach they are more inclined towards, ask what theoretical orientation they use and how that can actually map into your goals. Confirm the practical fit, location, language, session length, fees, online or offline availability. Then knowing if uh, about the cultural competence, are making sure that, like therapists making sure are they comfortable with their cultural background, values, or identity. So for this, people can actually use a consultation call also. They can request the therapist for a consultation call before the main session, like for a 15-20 minute session. That is enough to build a rapport and also discuss your cases. So there are few red flags that one should not miss while choosing the right uh, mental health professional they'll be consulting. So be careful if a therapist promises a miracle or guarantee cure, because nothing happens overnight. Nothing can be changed overnight. Uh, so a therapist making you feel small, foolish, or judged, because usually the sessions are very non-judgmental. If a therapist violates your boundaries, um, any therapist making you unclear about the confidentiality or the fees, pushes you into dependence, um, and then more they are more interested in giving you opinions than actually addressing your concerns, shames you for asking questions. So these are some red flags people should be careful about. Then a good therapist may challenge you, but they will never humiliate you. A good therapist may guide you, but they should not be controlling you. They should be warm, but at the same time, they should be professional.
So what if the therapist just keeps talking and I do not get enough space?
Usually, that is not the ideal situation that happens. Therapy is very collaborative. You
Okay, now this is one of the most important questions because qualifications alone are not enough. Here is how to choose wisely. What can you do right now if you are feeling overwhelmed but not ready for therapy? Can you tell us what happens in therapy, structure, modalities, and confidentiality, and what it is and what its time limits?
okay. So many people wonder what actually happens in a therapy session. And since a lot of people don't know, let me walk you through what they can actually expect. So the first session is usually an intake session where the therapist takes case history. During the session, your therapist will try to understand what brings you to therapy, explore your current concerns, the relevant personal and family history, how these difficulties are affecting your daily life, what changes you hope to achieve through therapy. So, together, you and your therapist will identify your goals and discuss the initial things you can do tailored as per the needs of the client. And it is also the first session is also about understanding the story also. And again, first two sessions are basically more about the patient or the client telling about their concerns, and at the same time they both setting the therapeutic alliance and building the rapport that is very needed for the client to trust their therapist. Usually, along with that, the therapist also explains about the confidentiality, the session structure, the fees, boundaries, and what therapy process may look like. Discuss the frequency and the s- sessions. So, confidentiality is something very important. What it means is, and where the limits actually lie. Therapy is intended to be a very safe, non judgmental, and a very collaborative space where you can actually express openly without the fear of being criticized or judged. So, I'll say that confidentiality is one of the very foundations of an effective therapy. In most situations, whether you share whatever you share in the therapy remains very private between you and your therapist. So, but and this sense of privacy helps people feel more secure enough to actually speak and express their emotions, experiences, and thoughts. However, confidentiality is not very absolute. There are certain legal and ethical situations where a therapist is required to disclose the information. These include situations where there might be an imminent risk of harm to the client themselves or someone close, or there might be an ongoing abuse or neglect that might involve a child, or situations where information is limited, or maybe insurance or reimbursement purposes. So, as a client, you should always feel very comfortable asking your therapist questions like, how are my sessions being maintained? Who has access to my records? How is my information protected during online therapy or even for the offline? A good therapist will answer these questions openly and very transparently. Helping this actually builds the trust more. So, after being discussed all of this, the therapy begins and shapes around the goals. Now, the therapy sessions may vary widely. Different psychologists used different approaches. So, expect a mix of talking, reflection, practice exercises, and sometimes homework as well. So, progress often emerges from consistently applying new skills and reflecting on the daily on the sessions that have been done. Briefly, I will tell you about few modalities. These are different evidence-informed methods used as per different needs. Like CBT focuses on the link between thoughts, feelings, behavior, often structured. Then there's ACT, acceptance and commitment therapy, for acceptance and value based change, building psychological flexibility. Psychodynamic approach usually explores patterns from past relationships, early experiences, and shapes the current behavior better. Lastly, EMDR is a very trauma focused tool that actually helps to process the traumatic memories.
Okay, thanks so much for explaining it so much in detail. Thank you very much, Simranjit. Now let us talk about something very important and very real. What if therapy does not seem to work? This is a question many people have, but they often hesitate to ask. Sometimes people feel disappointed, confused, or even blame themselves when they do not notice immediate change. What are the reasons therapy may not seem to work for some people?
Yeah, so it's very important to normalize the experience of therapy, not always working at first. Reasons include may include like poor therapeutic alliance, a mismatch between the approach and the issue, extreme external life stressors. Um, the client might be having comorbid medical problems, and or they can be very unrealistic expectation for quick change or something magically happening, or people might think that therapy is very going very slow. So what matters in response is that if you're not seeing progress, you may address this concern, because a psychologist will welcome this and do address these concerns and work accordingly. Sometimes the right next step is could be switching the modality, or could finding a different therapist if things are not working with one. Checking if again, it can also be from the client's side. What if they are not performing the activities that are being given by the psychologist? So not every therapist is right for every um, problem, because like I said that for different concerns, a different kind of psychologist is a better fit. So people may should also check for that. Also, therapy may not work because what if the person is not ready for the change? A lot of people come in therapy thinking that things will um, when they start taking therapy, things will automatically start changing. But a lot of clients don't know that the change can only happen if they are willing to change.
Oh, thank you so much, Simranji. So now one thing I wanted you to consider is how therapy. I mean, if we how therapy feels like from the inside. Have you ever wondered what therapy actually feels like from the inside? Does it feel comfortable, emotional, or you feel confusing or relieving? Can you explain what therapy really feels like for people from inside and will the therapist do? How it feels like from inside for people and what is the therapist doing for them?
Okay. So now let's talk about what therapy may actually feel like from inside, because this part is something that matters a lot. Sometimes the first few sessions feel relieving. It's more of ranting. Sometimes they may feel very emotional. Sometimes they may feel very strange because you're speaking more or honestly than you usually did. Sometimes people leave the session thinking that brought things up they were not expecting. That can be normal. Therapy is not always comfortable, but it should be emotionally safe enough. That is something that matters. You may begin to notice patterns like, I always apologize too quickly, I shut down when I feel misunderstood, I keep choosing the same kind of relationship, I get very critical of myself, I say I am fine when I am not. This awareness is very powerful, because once a pattern is visible, it becomes easier to change it. Therapy is often a place where people begin to understand that symptoms are not random, they are meaningful responses to stress, pain, learning, attachment, and and the lived experiences. So, therapy, I'll say, is not just about giving orders. It is about helping you understand yourself, you weighing your choices, and building the necessary skills so that your decisions become more grounded and less reactive.
Okay, so yeah, so we just one more thing, ma'am, says that can you shed some thoughts on how do you know when emotional distress has become an emergency? If you want to seek urgent help, how do you do so?
Yeah, now I want to address about safety clearly and the responsibility. If someone is thinking about self-harm with a plan or an intent, that is an emergency. If someone is unable to tell what is real, they might be in a severe state of confusion or is behaving in a way that uh, risks serious harm, uh, then urgent professional help is needed. If trauma symptoms or depression, anxiety, panic are becoming unmanageable, do not wait until things become unbearable before reaching out. Therapy can be a part of the answer, but sometimes urgent psychiatric or medical care is also needed. Mental health care works best when people do not minimize danger. So, I want to say this with care and directness that if you or someone near you is in immediate danger, contact emergency services or go to the nearest emergency hospital. Or so again, that is not an overreaction. That is more of a very responsible action, I'll say. Additionally, I will say that um, therapy works when goals are very explicit. We often set smart goals. Many clinicians use brief outcome measures, assessments, or session feedbacks tools, so you can see change and talk about what is actually working.
Okay, so thanks very much for that, Simranji. Actually, we are running short of time, so we'll just, I think, about the session. Before, I just wanted a little bit about the practicalities, fields, session length, and online therapy and emergencies. Just if you could lightly touch upon it, and then we can
Yeah, yeah.
conclude.
Yeah, sure. So, before starting therapy, it is helpful to understand few practical aspects, like the session frequency, if decided, fees, then what are the therapist qualification, experience, specialization. I've already talked about that. Along with that, for a lot of people, affordability is a concern, and there are several alternatives. A lot of people don't know that, but there are community mental health clinics, trainee therapists working under qualified supervisors, group therapy, or short-term goal-focused therapy areas. With growth and technology, online therapy has made mental health more accessible and convenient, especially for people in remote areas and those with busy schedules. So, however, it has limitations, but um, things have started improving. And it is equally important to discuss that emergency procedures with your therapist uh, at the beginning. So,
Okay.
yeah,
Yeah, so I think we have discussed the emergency procedures to some extent earlier. So if you just wanted to say that maybe there is a crisis helpline and
yeah,
emergency service, etc., for immediate support.
yeah,
So just so now that you have clarified most of the things and everything, so can you give us a final guidance and final, what do you call how this empowers the viewers?
yeah. I want to end by saying this, that finding the right help is a process, and it is okay if it takes time. You may not get the perfect fit in the very first try. It may simply mean you meet different person, a different approach, or a different pace. When you choose a therapist, remember look at the checklist that I shared with you. And when you begin therapy, remember you don't need to know everything. You only need willingness to begin.
And you may have some final three questions they can ask before starting.
Sorry.
Like, you say, if there are three questions, you would say, what are the three questions that they can do ask before starting the therapy?
Yeah. What is your training experience, and with respect to my concern, what approach do you use, and how we will know therapy is helping me?
I'm sure this will help all of our viewers to remove the confusion and make an informed choice. So, thank you very much, Simranji, for having spent this time with us, taken time off your busy schedule and coming late in the evening to discuss on this topic. So, thank you very much. I appreciate this, and we will look forward to you for another session on another topic very soon on this channel. Thanking you,
Thank you
Simranji.
for
Thanks
being
a
here
lot
with me
for.
today. Thank you.
Huh? Thank you very
Thank
much. Thank you very much. So have a good day. Have a great evening. Goodbye. Bye. See you soon.